Learning things in the classroom is a lot different than applying things in the workplace. Humber River Health really helped push me to learn a lot more and get me out of my comfort zone.
Getting to have an impact and contributing positively to patient care in a more indirect way, I think is one of the best outcomes of this practicum.
My name is Melissa Fiore.
My name is Semsem Ahmed.
I'm in my 4th year, actually finishing up my Bachelor of Health Studies degree, specializing in health management.
I graduated from York University's Bachelor's of Health Studies program.
And I took the course HLST 4990, is the Health Studies practicum.
I began the practicum in January 2024, and I'm really proud to say I got to transition into the role of Medical and Academic Affairs Specialist.
The practicum is an amazing opportunity for students to apply what they have learned in their degree in a real-world setting. And at the same time, in building disciplinary skills, they're building transferable skills. Students are doing primary data collection, they're doing survey work, and what the students have found and are reporting on are completely relevant to issues that the organization is having, and now they have the evidence to move forward on that strategic initiative to make improvements to their operations and to better patient care.
I was enrolled in the professional practice department, mainly focusing on the new staff orientations that occur each month. It really helps set clear expectations and guidelines for all of the new staff, both nursing and non-nursing, coming into the hospital, and really supports their understanding of any new systems that they may have to use and who their practice leaders are.
I had the opportunity to support our physicians in gaining faculty appointments at the University of Toronto. That would offer them an official title and affiliation with the institution and provide them with the opportunity to supervise medical learners. My main focus was creating a streamlined and integrated process to make it easier on our physicians who have, a lot of time constraints.
We have been collaborating with York University for over 3 years now. I work very closely with the education coordinator at York to make sure the students are the right match with their supervisors. They are guided throughout their placement and they have that support, which makes them very confident. And I've always seen them wanting to come back, so that's a great experience we have here.
I definitely learned a lot of communication skills and professionalism between coworkers, whether that's through email, whether that's a phone call, whether that's in meetings, and how each department works together so cohesively.
Getting to hone in on those skills that I really wanted to enhance through the practicum on a day-to-day basis. That includes, leadership skills, decision-making skills, being that facilitator between our physicians and academic institutions has really allowed me to have a boost in confidence and really come into my own in the healthcare system.
The experiential learning department is a different lens than we've had in the hospital before, so they bring a different type of knowledge and experience with them that's invaluable for us to integrate. These students have done work that we could not do, down to the level and granularity that it would be impossible to do as an organization to keep us on track. So I know staff are very appreciative of all of that support, especially after you establish relationships, with students when they're starting to understand the organization and the flow.
It was quite impressive to see how they were able to pull together, being completely new to the hospital environment and being completely new to required practices at an organization such as this. They actually really demonstrated a very high level of autonomy and independence and very little hand-holding, which was absolutely amazing to work with.
Healthcare is an ever-changing system ultimately, and that's something I want to also do, change with the current times in healthcare and what systems need to be challenged now. And the program alongside the practicum really helped me focus on what I'd like to do in the future.
Getting to see myself in the healthcare system contributing in a meaningful way for the first time was really one of the best outcomes of this practicum.